Hello everyone, welcome back to my channel. Today I have come with the details of Novavax, a recently introduced COVID 19 vaccine that is made with nanotechnology. If you want to know what Novavax is and why it is different from other COVID 19 vaccines, please follow me till the end of this video. Novavax is a protein subunit vaccine, sometimes called acellular vaccines, that contain purified pieces of the SARS-CoV-2 spike protein, which have been specially selected for their ability to stimulate immune cells. Because these fragments are incapable of causing disease, subunit vaccines are considered very safe. Novavax is formulated with Novavax patented saponin-based matrix M adjuvant to enhance the immune response and stimulate high levels of neutralizing antibodies. Matrix M is composed of 40 nanometer particles based on saponin extracted from Quileha saponaria molina bark along with cholesterol and phospholipid. These vaccine actually enhances biological function to generate long-lasting immune responses that increase neutralizing antibodies and induces long-lasting memory B cell populations. These memory B cells enhance B cell immunity and recruit CD8 and CD4 T cells that boost the T cell immunity. While other vaccines trick the body cells into creating parts of the virus that can trigger the immune system, the Novavax vaccine takes a different approach. It contains the spike protein of the coronavirus itself but formulated as a nanoparticle which cannot cause disease. Novavax vaccine uses a longer standing protein based technology. The flu vaccine and the hepatitis B vaccine, which doctors have administered throughout the US since 1986, use this technology. The proteins inside the Novavax vaccine mimic COVID 19 spike protein. They were created in moth cells and then assembled into nanoparticles. While they share COVID 19's molecular structure, they do not replicate or cause COVID 19. A full course of the vaccine requires 2 doses taken 3 weeks apart. Overall, the researchers found that Novavax vaccine was 92.6% effective against the alpha and beta variants of the virus. Novavax tracked the side effects of their vaccine for 7 days after each dose. Data so far suggest that on the whole, the Novavax vaccine may have fewer side effects than both the Pfizer and Moderna vaccines. Any side effects from the vaccine were largely mild to moderate and transient. World Health Organization recommends Novavax for those living with conditions that increase the risk of severe COVID-19 such as cardiovascular disease, respiratory disease, and diabetes, people who have contracted COVID 19 in the past, and lactating mothers, but does not recommend to get the vaccine for people with a history of anaphylaxis to any component inside the vaccine. The phase 3 trial in the US and Mexico and the UK did not raise any safety concerns. The trial was called the Prefusion Protein Subunit Vaccine Efficacy Novavax Trial COVID 19 or Prevent 19. Novavax said its vaccine showed cross reactive immune response against Omicron and other coronavirus variants, though the neutralizing response for the Omicron variant was 4 times lower than for the original coronavirus. The shelf life of Novavax is 6 months at 2 degrees centigrade to 8 degrees centigrade. These vaccines could also be cheaper to create and distribute, and they can be stored between about 36 and 46 degrees Fahrenheit. Unopened multi-dose vials should be stored at 2 degrees centigrade to 8 degrees centigrade, stored in the outer carton to protect them from light. A third dose of Novavax's vaccine, administered to adults 6 months after their first 2 shots, bumped antibody levels against the Omicron variant 73.5-fold and was more effective in stopping Omicron from entering cells. The 73.5-fold increase was higher than for Pfizer and Moderna booster shots, which increased antibody levels 25-fold and 37-fold respectively. Novavax secured an emergency use authorization in India for adolescents aged from 12 years to 17 years old. With this EUA, Novavax receives its first authorization for use in the adolescent population. The authorization in India was secured by Novavax partner Serum Institute of India, which manufactures and markets a version of this vaccine under the trade name Covovax. Apart from India, Nuvaxovid is also authorized for emergency use in adults in other highly populated markets like Australia, Canada, Europe, and Indonesia. However, the vaccine is yet to be authorized in the United States. Novavax EUA filing with the FDA, which seeks authorization for use of this vaccine in adults, is currently under review. Novavax also submitted regulatory filings seeking authorization for use in Japan and South Africa. Thank you for watching. If this video is helpful for you, please do like, comment, share and subscribe to my channel. See you next time. Until then, be happy and fit and keep knowing the biotech treasures.